Hi there.
I'm Andy, the chair of the trust.
Hi, Andrew.
Really nice to meet you. I'm just going to give you, and welcome Gemma as well. You know me, Gemma.
Yeah.
I'm just going to say that you've got the board here. So we've got, and I'm just going to go down the list of names because otherwise we'll be here all day if everybody introduces themselves. Obviously, Andrea, Chief Nurse, Mike Baxter, Non-Executive Director, Chris Ketley, Non-Executive Director, David Fluck, Acting Chief Exec, James Thomas, Chief Operating Officer, Jane Dale, Non-Executive Director, Keith Mulkern, Non-Executive Director, Louise, the Workforce Director, Marcin, Non-Executive Director, Marcin Waterman. We've got Lord Andrew Mawson in as an observer. We've got Merrick Vivers as a Non-Executive Director, Sal Morn as our Corporate Director, Simon Marshall as our Finance, Tom Smurden as our Strategy Director, Zach as our Acting Medical Director, and we're also welcoming today Sue Johnson from the CQC, who's sitting in on our board meetings today. So you have a full panoply of people here, Emma, and we're really looking forward to what you're going to say, and then we'll do some Q&A afterwards, if that's okay.
Lovely. So a big audience.
And if I could ask people to keep their cameras on, actually, because nothing more disconcerting than facing a blank screen for Emma. So please keep your cameras on, but keep muted. Thank you.
Thank you. So hello everyone, and thank you for the invite to speak to you all today and tell you a little bit about my journey through COVID and how it's affected my role, the women that I care for, and my maternity colleagues. So my name's Emma. I've been a community midwife for the past 4.5 years at St Peter's. I've been at St Peter's since 2012 after entering midwifery following initially working as a nurse. So I come from a sort of high risk background in nursing, but the change over to midwifery has made me really passionate about empowering women. And what I love about working in the community is that I get to really share in a woman's journey to motherhood. So I get to see them at the very beginning of their journey, all the way through their pregnancies, and then care for them after their baby's born alongside their babies as well. So we get to build really trusting relationships with the women. We get to support them in their birth choices and see them change as a person, really, from the experience of being pregnant and childbirth and everything that brings. So I get to see really proud mums at the end, which is really, really lovely part of my job. But before we saw the changes in care that were implemented as a result of COVID, in the community we were already affected by it. So we already had very early on in the year women who had heard about COVID in the news and so forth, actually refusing to open their doors to us as community midwives. And we were challenged with that really early on by women not wanting to open their doors, already isolating before any advice went out to them, and not wanting us to care for them or their babies after delivery, which was quite difficult for us to comprehend because we didn't really understand a lot of it ourselves. And it was all unfolding globally, and women were really, really scared at that point. So we had women who were also fearful of walking into the GP surgeries for their antenatal appointments, and also women who had never ever probably would have considered home births started requesting home births because they didn't want to enter into the hospital environment. So they were very, very scared. And for us, that was a huge safety issue, but also a bit of a safeguarding issue as well, because we weren't able to view these people in their homes, caring for their babies, and do the normal assessments that we would do as part of our job. So really, we were in quite unknown territory, having to reassure these women when actually we were fearful ourselves and unsure really of what was unfolding, what was happening. And then actually overnight, going from trying to reassure these women, suddenly the government made announcements that changed the way we saw pregnant women in terms of the advice. And literally overnight, I went from my clinic one day trying to reassure women that they were going to be fine and they were well looked after, to 5 o'clock that evening, my phone ping, 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 because they'd announced that suddenly pregnant women were in that vulnerable category. And women were incredibly frightened and scared and unsure of what that really entailed and what that meant. So we went from reassuring them to them, their trust in us, I guess, faltering a little bit, because we told them one thing one day and the next day we told them something completely different. So that was really difficult for us to manage. And then devastatingly for the women and passionate community midwives like myself, our home birth service was suddenly suspended. And I happened to be working on the Saturday that the decision was made at board level that we actually couldn't safely provide that service because of everything that was happening. And because I was one of the community midwives working that day, I actually had to make those phone calls to those women that were booked for home births and tell them that actually your choice of a home birth is actually being taken away from you because we can't provide you with this service anymore. And it was a really hard thing for me to do, because on top of a already heavy workload that we have when we're working on weekends, I had to deal with the emotional side of that and having that conversation with women, which was really difficult. And of course, that decision was the right thing to do, because we need to ensure that if complications arise during labour in a home birth situation, that we can safely transfer women to hospital if we need to. And the ambulance service was so stretched at the time with the rising COVID cases that we just couldn't guarantee this, and we couldn't safely provide that service to women. So for the women themselves, that was a really huge blow, because for a lot of them, being at home was their safe place, and they were really scared about coming into hospitals. And I think at that time, people were starting to consider home birth as an option who hadn't previously done so. So the anxiety levels around this were really, really huge. Home births in particular are a real passion area for me. I've witnessed women sort of believe in their bodies, trust in their bodies to deliver their babies in a really calm, relaxed environment at home. And our role goes from very much delivering babies to actually just supporting and observing these women, because they're in effect doing it by themselves, and we're just there for them, because there's less need for interventions and that sort of thing in the care that we're providing. I actually wrote my midwifery dissertation on home births, and personally went on to have both of my daughters at home. So I'm a really active promoter of home births and giving this option to women who are suitable. And my dream for our maternity unit is that we can really implement a dedicated home birth team to give women this choice without conditions around staffing levels, because currently we're not able to robustly provide this service because the staffing issues that entails. And if we had a dedicated team to do this, I think actually our home birth rate would be much higher. Generally in the country, it's around about 2%, and I know our home birth rate is nowhere even near that at the moment. There's so many positive aspects in terms of home births themselves, not just for the women, but for the families and the delivery itself. But there's also evidence of less interventions, better outcomes for mums and babies, and actually long term there's real reduced costs for the trust as well in those women that are suitable. The next big battle of lockdown for us was the closure of some of the GP surgeries, which again happened overnight, and midwives turned up to surgeries with the doors shut and us not being able to. It wasn't all of them, but some of them it was very much like that. So having to manage that was difficult. And we immediately had to find a new way of delivering care and doing so as safely as possible when we had a lot of barriers sort of preventing us from what we would normally do. So as midwives, we care for women face to face, and we enjoy delivering that care in that environment. But very quickly we had to enter an unknown world of really sort of doing lots of phone consultations, very quick pit stop appointments. So we were reducing the contacts and shortening the contacts that we were spending with women to reduce everybody's risks. And not getting to necessarily meet women in the first instance as we normally would do in providing them care through their pregnancies, and instead providing more sort of virtual care in the way of phone calls and video calls and those sorts of things. And the anxiety around all of this didn't just come from the women, but it came from the staff as well. And a lot of people have coped with it very differently. We're having to adapt really quickly to the changing working environments, the way in which we deliver the care, and all whilst we're very anxious ourselves and worried about our own families. So whilst others around us were stopping working, going home, and being in their safe havens by being furloughed and working from home, we were very quickly masked and gowned up and still working really hard to try and make sense of it all and provide the care that we were able to sort of provide for our women. And I think it's really important to note that pregnancy itself is a huge life-changing moment for women, and so many changes happen to a woman in that time, physically and emotionally. And it's a difficult time for women without facing COVID and factoring that into the equation. But then we took away the option of home births for some women. We had to stop partners coming to appointments with them. Women were attending scans on their own without necessarily having that support person with them in case they were delivered bad news. So emotions really have been running high for everybody, and I really feel that the brunt of this has been felt by the community midwives more so than some of the other areas, because we're their first point of contact. They have our phone numbers, they see us in the clinics or they speak to us on the phones, and they're asking us an awful lot of questions that we often don't have the answers to. And managing that has been probably the biggest challenge for us, is answering all of those questions, not knowing the answers ourselves sometimes. Our workload's increased because we're having to screen everyone before we see them to check that they are COVID symptom free. If they're not, making arrangements as to how we deliver their care safely for them. And yeah, that's sort of impacted what we're doing, because that makes it more timely if you've got to do all of that before they even come in and see you and you do all of their appointments. But also our workforce was instantly hit. We were already managing huge caseloads that were already a struggle and hard to manage, and bigger than they really should be. But also a lot of our staff fell into the vulnerable category, either through their own health conditions or pregnancies. And so instantly there were people that couldn't work, individuals who had family members with symptoms or themselves with symptoms that were having to isolate for long periods of time, that really suddenly made our workforce much smaller, and our workload had already increased. So while they were off, we were having to really juggle all of that, and we're still having the impact of that, even though we've got testing in place now. I'm very passionate about providing safe, holistic care, providing continuity to the women, but COVID's definitely affected our ability to do this, which makes me really sad. I feel that the lack of national guidance has been another really difficult area in terms of decision making, because the guidance and restrictions have been very different among local trusts, and because our restrictions haven't been the same across the board, and people have friends in different areas and talk to each other, we're constantly being questioned by the women on this, and rightly so. We obviously understand what their anxieties are and why they feel this way, and we're having to constantly explain that. So those small pockets of time that we're having with women to deliver the care are being taken up by managing all of these anxieties and answering all of these questions. And that takes away from the care that we really want to provide to those women as well. They're desperately craving the answers around whether their partners are going to be with them, are they going to be left to labour alone? They're fearful of all these things. They're worried about receiving bad news and not having a support person there with them. And I feel we've dealt with it really well. But there's a lot of scaremongering. There's a lot of people saying one thing in one area and another thing elsewhere, and they're hearing stories of what's happening at other trusts and thinking that we're doing the same, and it's not necessarily the case. So we're having to provide an awful lot of reassurance emotionally to the women at the moment, and that's just continuing. We're still doing that an awful lot. We've been able to lift some of the restrictions, and women have been supported throughout their pregnancies. Partners are able to attend some scans now, and women are able to have home births again because it's safe for us to have the ambulance service supporting us if necessary in emergency situations. And we've got amazing support from the women, I believe, as well. Overall, the feedback from the women is that actually they do feel supported. They do feel that we've communicated well with them. And on the whole, I think they understand the changes and they understand the restrictions that have been put in place and why they are there. But of course, there's always going to be people that don't understand and people that find that more difficult. And trying to verbalise why we're doing what we're doing is difficult for us all, I think. I think there's been some real positives that have come out of the changes that we've implemented. So we've introduced new care pathways for the women and how we look after them through their pregnancies. And although these are still works in progress and they may well change a little bit, we've seen real positives around them in terms of reducing waiting times for people coming into clinics, reducing the amount of appointments in particular times in the pregnancy that women have to attend, which we've had a positive response from the women in relation to. We've really embraced the digital world a lot more, so mums are getting a lot more support virtually by receiving things like breastfeeding support via video calls, and so the actual contact we've had with people has increased in some senses, even though we're not necessarily seeing them as much face to face. As a result of having to cancel, unfortunately, the group antenatal care we'd normally offer, we've been able to record antenatal education videos to provide information for the women to support them as well. And we're working on introducing virtual group sessions, but those videos, even without those virtual group sessions coming in and the reintroduction, hopefully, of group care again in the future, is actually a welcome addition, because there's always going to be some people who are shy of being in group environments and scenarios, and probably people that wouldn't have put themselves in that environment and wouldn't have attended those, that have now got those videos to watch. So actually that's providing something extra.
Emma, I just wanted to give some time for questions, because you've covered such a huge amount of ground, and I can feel your passion coming out on that. But I wanted to give also some time for questions, if you don't mind.
Yeah, no, that's fine.
And I just want to start off by saying, you know, I'd rather you than me being telling all these women that they couldn't have home births. So well done you. Did you feel kind of supported in that? Did you have options, like did you have options of you could use the birthing centre, for example? Did you feel supported by the trust in all this?
Absolutely, yeah. I think the decision to remove the home birth service at that time was the right decision. We needed to make that decision, and we've got a great service that we're still able to provide. We have our birth centre, so we can still give women the option of having low risk deliveries. It's just the environment slightly different, but we can mimic that home environment as much as we possibly can in the birth centre, and we were still able to help women with that, definitely.
Okay, thank you. So I'm going to ask Jane first question. Thanks.
Thank you very much, Emma. That was really fascinating, and obviously a really difficult time that I think the team have dealt with incredibly well. I was a midwife in the past, and I had home birth, so I know exactly what you mean about your passion for that, and I absolutely support that. One of the things I wanted to check is, were you as a team, you very much have been supporting the women and the families, but how about you as a team? Have you felt supported through this yourselves? Because it's been a difficult time for you as a community team. So I just wanted to be assured that or is there anything you need that we can support you with?
I absolutely feel we've been really well supported. I think as a unit, maternity really has pulled together. I think we're all communicating so much better. Gemma and the senior team introduced our virtual unit meetings at the beginning of COVID, and they've continued. And I think it's really given the opportunity for staff that maybe wouldn't have spoken up previously to start having a bit of a voice and communicating much better. And yeah, our senior team's been amazing in terms of that, and definitely feel that we can go to them if we've got any concerns around anything at all.
No, that's good to hear. Thank you.
So James, I think you were next.
Hi, Emma. Thanks very much for that. That was really interesting, and I think really portrayed extremely well the multiple pressures that you're under. So you've got the increasing workload because of screening, you've got the increased anxiety of the patients and ladies you're dealing with, but also the pressure from working in a world where all of your neighbours and colleagues neighbours and friends are at home, locked down, and you weren't. And I think that is something that we underestimate. And I've been talking to people across the trust, and just coming into work would have been difficult enough in a world where everyone else was told it's too high risk, you need to stay in your house and keep your family in your house. And yet we were going to work, and you were going to work, and children were going to school, or wherever it was. And I just wondered if you think there's anything else that would be helpful for us as an organisation to think about in terms of some of those lower level foundation needs, that people felt that they were doing things, even, we didn't get a chance to think about what we were doing in terms of exposing ourselves, but it was always there. Do you think there's anything that we should do, or we should reflect on about that?
I think there's two aspects to it, really. I see obviously the difficulty we all face because we're all worried about our own families personally, but actually I felt benefit from being able to go to work. I feel really lucky that I had my work, because I've had routine, and I feel my children have had routine because they were still able to attend childcare, because my husband's a key worker as well. So we were able to get up and go to work and keep going, whereas other people, I think, found it a lot harder than I did personally. So actually, I felt I've coped quite well through COVID because I've had that. I think other people might feel slightly differently about that, and it's certainly been a positive in the overall picture of COVID for me, really. So I don't think there's anything different that we could have done. I think the communication around perhaps the restrictions coming in from our point of view, and I think from your point of view as well, is the government with their restrictions, if they gave us a heads up to those sorts of things, would have been really helpful for us to be able to manage how we're doing things and know what to expect.
Yeah, thanks, Emma. Thank you very much.
Okay, and I think we've probably got time for the 4 hands that we've got up at the moment. So we'll go to David first, and then we'll go to Chris.
Thanks, Emma. That was a really brilliant story about what you went through. I think what came across to me was one of the biggest issues was how the advice changed and how the advice was at variance throughout this time. And I suppose one of the learnings, I think, and I just wonder what you think about this. We know from flu that women are more susceptible to flu because of their immunocompromised state. So it did seem quite a long time, I think, that we caught up with that understanding before. And I think, did you have worries about it before the advice came that pregnant women were an at-risk group? Did you as teams worry about that, do you think?
I think so, because we had women questioning it really early on. We had those people that didn't want to let us in and didn't want to come to the surgeries, and were turning up wearing masks and were really fearful early on. And that made us question it all as well, because we just didn't know and we didn't understand it. So we were giving advice, reassuring people that actually they're saying at the moment that it's fine, you're okay, and then they changed it overnight, and we had no idea that was coming at all.
Yeah, I suppose, and that's one of the things that we felt, Emma, was that the advice was coming from different colleges, different government agency groups. But actually, in terms of the maternity service, the evidence was very clear that it would be at a risk group. So I think that was an area that was just blindsided all that. So you illustrate that absolutely brilliantly. I think the other thing is, I would just agree with you that I think that maternity and women's and children, your profile is very much raised in the organisation. I mean, Gemma pulls me around looking around maternity on a monthly basis at the moment. So I completely agree. I think we're getting a greater understanding of what some of the issues are and everything. So thank you for that.
Okay, Chris.
Thank you, Emma. I was very humbled by that story. We're very lucky to have you, and I'm glad you kept well throughout, and your husband. So it's very partner role. Thank you very much for that. I guess the two things that came out for me was around preparedness, and the other was around communication, and how it fundamentally changed things. I mean, I've been very fortunate that my granddaughter is actually a year old today, and I'm going to a birthday party later on after all this. And my daughter had her in the hospital, but two of her friends didn't, and they went through the process during COVID that you've outlined. And I think, to me, that you don't underestimate never underestimate your massive role as a guardian angel and being the anchor to them, because the guidance you need to give mustn't be underestimated. And I guess my question is around, did anything go wrong, and also around the partner's involvement, because it's a mental thing, isn't it? It's a mindset, and how did they adapt? Did you have any experiences where things went really awry, or you had to really pull things together to make sure that things didn't go wrong in terms of mental change to moving from the home to the hospital?
I think that's a really hard question, because I think we've really been doing that the whole way through. I think we underestimate the effect that all of this has had on the partners, because they really want to support the women, and they've been really alienated from the pregnancies. Personally, one of my reasons for having a home birth was I wanted my husband to be involved in the birth of our children. And I very much feel in a hospital that partners sit in a corner of a room and feel very uncomfortable. And I didn't want my husband to feel that way. I wanted him to feel very much part of it. And by not allowing partners to come to appointments and come to scans, they feel very disconnected from their unborn babies and their babies when they're born. And I think the initial period of time with them trying to bond with their babies is probably more difficult at the moment than ordinarily it would be.
Yes, I mean, my wife was actually at my daughter's birth with her husband, and it's incredibly difficult, isn't it, for those sort of circumstances? How did they get managed when even the individual partner wasn't allowed?
Well, we had to stop the additional birth partners, so only allowed one person, and choosing that one person for some women is really difficult, because some women will have a great relationship with their mother or a friend that they want there as a support person, and they might want those people there instead of their partner. So that's a really tough decision for them to make, because again, they don't want to alienate their partners from the delivery either. So that's really impacted them as well, because some people feel they need both those support people. Yeah. We've not been able to provide that.
Okay, so we're going to have the last two questions now. We're going to Tom, and then we'll let Andrea finish off. Thanks.
Thanks, Andy. I know we're short of time, so I'll try and keep it short. Thank you, Emma, for that insight. I found that really fascinating. I really appreciate you spending the time to give it to us. My question really is about the future. Because you talk about a number of things that obviously were very difficult, but there was a lot of kind of optimistic things in what you said. And obviously we've got our operating model and our plans, which are really based around eliminating infections, but actually play into an awful lot of what you were describing. Reducing intervention levels, doing more of our care in the home, in the community. And I just wondered how you feel about the future, and whether you're optimistic about how the service might develop given what's happened.
Absolutely. My biggest passion is the home birth, so introducing a home birth team and sort of empowering women. And I feel tying that in with the digital world that we have at our fingertips, and how we can really take advantage of that in terms of educating the women and providing them understanding, because I feel the home birth rate is very low because women don't understand it. It's a norm for them to go into hospital. Their friends do it, their family members do it. And if women have a baby and they get together with their friends and they talk about their births, generally the way the conversation will go is people focus on what happened to them in terms of the negative and the poor experience that they maybe had. And I feel women almost, if they've had a good experience, hold that back because they feel guilty that they've had the good experience and other people might have had the bad. And I think we need to really change that culture and get people to open up and talk about positives more. I'm a big believer in positivity and having cups full, not empty. And I think we need to sort of promote as much as we can, and by using the digital media that we have to be able to do that, I think we can really make great benefit in terms of changes that we can make. Definitely.
Great, thank you.
Okay, Andrea.
Thanks, Andy. So I don't actually have a question. I've really just got a comment. I just want to say a huge thank you, Emma, really. That was truly very insightful. It really was. And I think, you really should be proud, you guys, of what you've achieved during this time, because, you have faced quite a bit of adversity, not just from obviously, the backlash on the COVID, that whole situation, and the women and the mothers, but also you lost a colleague as well, didn't you, during this time too? So that's, huge impact of having to deal with that with the team as well. So my question was going to be around what James, just making sure you guys are okay. But I think your passion, your upbeatness comes through, and I think the future is very rosy. Just leading to Tom's point around that. So well done. Really, is all I wanted to say. Well
Thank
done.
you. I really appreciate you bringing that up. Actually, something I did want to touch on was that loss. So we lost two very special people actually during this year. First of all, we lost Jane, who passed away following a battle with pancreatic cancer. And then Jane, one of our community team leaders, actually became unwell very suddenly and sadly passed away. Both of them were really passionate midwives and really dedicated to St. Peter's. And they were fantastic colleagues and friends, and as a department we've been devastated by their loss, but even more so I think we're all really sad and angry that because of COVID we've not been able to really say the proper goodbyes. We weren't able to attend funerals and we weren't able to really hold proper memorial services yet in their honour, and the impact for this has been enormous for us alongside everything else as well. So thank you for mentioning both the Janes.
So if anything could have cemented in my mind the value of staff stories, it's this one. I want to really thank you, Emma, because this brings us closer to the coalface, makes us understand what you face, and your wonderful positivity. Thank you for that, and sharing your story. But it's been, been a really tough time for people, and people not being able to attend funerals in particular. I couldn't attend my own sister's funeral. It's been an awful time, and I think you and the team have worked through it brilliantly. So thank you ever so much for bringing your story. I'm going to give Gemma a minute, your minute of fame with the board, if you'd like to. If you'd like to say something, Gemma, because I know you're equally passionate about the service that you're leading at the moment.
I can't tell you how proud I am of the team, the way they have pulled together. They've continued. We have been one of the few services that have not been able to cancel elective activity and divert all our attention to that acute care. And we've had to carry on our business as usual whilst changing everything at the same time. And they have just faced that with incredible positivity and camaraderie and really living that value of putting the patients first. And so I couldn't be more proud of them. I think we've got an exciting future ahead of us. And I think to Tom's point around different models of care delivery, that continuity of carer is going to be one of those things. It is part of the National Transformation Programme, but actually if we really want to move services out of the acute setting, if we really want to deliver good outcomes, that is the way to deliver it, albeit I appreciate it is not the most financially effective model, but it will long term. So I'm excited for our future. The team here are an incredible team.
Thank you, Gemma, and well lobbied as well there. And just to say, I really enjoyed my trip round maternity with Gemma a couple of weeks ago, and delighted to say that Jane is going to become the non-executive director with kind of special interest in the maternity side. So we're delighted about that as well. So thank you very much, Gemma and Emma. Thank you for taking the time out of busy days, I know. And we really appreciate you listening to your story. Thanks.
Thanks, Emma.
Thank you. Thanks very much.
Bye. Thanks, guys.
Well done.
Okay. Well, I thought that was really, really helpful. I don't know if anybody else wants to make a quick comment. I know we've run over, but I thought it was worth it.
I mean, can I, Chair?
Yes,
I mean,
please.
I had a long conversation with Emma yesterday, and and she's articulated exactly their experience. And I think, when we present data on a page to the board, and we show you things like the number of staff that were off sick at a single time, you don't really kind of get the feel of the impact of that until you hear a team talking about how that was so difficult for them in the eye of a storm. So I think for me, it just illustrates perfectly the things that are quite hard to get across to colleagues when you're presenting data and papers.
Yeah. And Andrew, you've got a...
Yeah, I thought that was a brilliant presentation. My daughter's a midwife, so I'm very conscious of what they've been facing out there at the front edge of this period. Very, very difficult. And I thought she was really good. And it would be good, Gemma, because one of the things we're looking at around you at the hospital site is where midwifery might be based in some of the surrounding communities and what the connections and innovation opportunities are. So it'd be good to just talk to you a bit about that. And maybe we could bring Emma into that conversation with that practical experience there, because she's right, there are opportunities for innovation there, and also on the business model and some of that stuff, and it's a thing we need to get into so we don't lose this opportunity to really think about the future together. So yeah. I personally found that really helpful.
I think, Andrea, you can make that connection, can't you, for them? One challenge I want to put out again to the executive team, and I'm sorry if I'm a broken record. Can we agree with other hospitals around us, the visiting side? Can we have a Surrey Heartlands approach to this? I know it's tough. I know everybody has slightly different views, but at least if us and Royal Surrey were the same, it would actually help, people on the ground. I felt for Emma, when she gets it right in the neck, saying, my friend in Royal Surrey can do this. Why can't you do that? I know it's tough. I absolutely know it's tough, but it would be great for our mums if we could do it. So it's just a challenge. David.
So it's a very good challenge, and you're right, it's tough, and you're right, it's got to be the right agreement. So I mean, I'll take you up on that challenge, Andy, but we need to make sure we get to the right
Yeah,
agreement,
absolutely.
because there is, as we'll talk about probably later on, there's a lot of pragmatism and trading things for other things which are probably going to give us more problems than benefits. So we need to get to the right answer, and I agree that if that was all agreed, that would be absolutely brilliant.